Hello, this is Bob Brown with Community Coronavirus Update number 104. Themes today: the hospitals are at capacity due to the Omicron surge that some thought might not be as severe. Unfortunately, that's proving not to be the case. And so really it's up to you to get a better mask and get a booster if you haven't had one yet. So you've seen the headlines that the hospitals in Nebraska are full. They're really worried about being overwhelmed. Thankfully, Omaha has went ahead and put in a temporary mask mandate. I wish Lincoln would do the same, but at least a number of Lincoln organizations have already done so, like Lincoln Public Schools and the University of Nebraska, for example. Here locally in Lincoln, Nebraska, we're up to 142 in the hospital, with 96 being county residents. Because of this rapidly increasing rates, we expect this to likely get worse, and hopefully contingency plans in place will help offload some of this if it gets too severe, but we're not sure how that's going to work out. Omaha, similar problems. They're up to 387 hospitalizations, and this is likely to continue to go as well, at least until the hospitals hit capacity. You'll see if you're here, they hit the highest capacity they've had in 2 years, so it's a question about where these other people are going to go as they end up in the hospital. I think the problem is people were there's a narrative out there that, oh, Omicron's not so bad, so we don't have to worry so much. At the individual level, there may be a lower chance of you yourself being in the hospital. Mainly that's if you're vaccinated. And so what we're really seeing is the reason Omicron is less severe is because of the underlying immunity in the community that's there. But the problem people that weren't considering is, okay, maybe your chance of being in the hospital is about half as much. When you have 5 times as many cases, that still more than overwhelms the hospitals. And that's really what's creating the situation we're in right here. There's just so many cases spreading. It's really gotten to the point where it's overwhelming things. Hospital system after hospital system across the country keeps showing these. So in Lincoln, maybe 20–30% of these adults don't have a vaccine, but they're still making the most up the majority of the hospitalizations. Those who've had, say, 2 shots of Pfizer, they're ending up in the hospital a little bit, but not near as much. And very few people who've had a booster are in the hospital. Most of these people have other underlying conditions. They may have had a kidney transplant, for example, or be under chemotherapy. And even despite that, they're not making up the people who are in the ICU or on ventilators. Here at Bryan in Lincoln at Bryan, they're basically none of the ones who are boosted are the people in the ICU, so they're not as sick. Also, more and more people are doing these comparisons, looking at your odds of being in the hospital or the hospitalizations per 100,000, whether you've been vaccinated, whether you had 2 shots or you had a booster. Here, this Massachusetts study showing you're 5 times more likely to be in the hospital for being unvaccinated versus just 2 shots. But if you had a booster, being unvaccinated would make you 31 times more likely. So essentially, a huge reduction if you've got your booster. In Nebraska, I was talking to our state epidemiologist yesterday. They've actually run these data. They're going to create another visual like this specifically based on Nebraska data. They're showing basically if you've had 2 shots, you're 8 times less likely to be in the hospital than an unvaccinated person. And if you had your booster, you're 36 times less likely. So huge effect. So get your booster if you haven't as soon as possible. Numbers after numbers. I'm not sure how many numbers it would take. If this isn't convincing you, then there's probably not much more time use talking about it. The big problem, of course, is what we've seen is, the headlines were that the hospitalizations now are worse than at any time in the pandemic, even last surge. If you look over here, you'll see that this dark line is the elderly who are more likely to be in the hospital. They've not exceeded the previous surge. It's the younger people, and especially this yellow line, which hardly moved, that was younger people, is starting to go up now. And as someone who cares a lot about the kids and worried about our school system, this has had a lot to do with why we put masks back in place. So, for example, if you look over in the New York, New Jersey region, they went up first. They're having 6 times as many hospital kids in the hospital as the last surge. If you go to the southeast, you may remember that the schools in Florida and Georgia, they said, hey, we'll just send kids in the school and let them, quote, get to natural herd so they can be done with it. Well, they had that huge spike in hospitalizations. They're already above that later now. So that didn't work. So get your kids vaccinated because they can get sick multiple times from coronavirus. That's still a big misnomer out there that if I get the infection, I'll be good next time. You might be good for 3 to 6 months, but not much longer than that. And there are documented cases of people getting 3 and even 4 cases of Omicron. So someone who may have gotten Wuhan initially, then Alpha, then Delta is now still getting Omicron, for example. So the best bet is still getting vaccinated. If we look here locally, in our region, this is also a problem because although Omaha Children's is full, people thought, well, maybe we could send people to Des Moines and Kansas City, but those hospitals are also full. So there's no capacity left in the children's hospitals in our region either, and those numbers keep going up. And again, vaccination and hospitalizations in kids, this study from a few days ago that was just published, basically for the multi-inflammatory syndrome that happens in kids sometimes 4 to 8 weeks after they've had coronavirus, the having 2 doses of the Pfizer reduced their odds by 11 times, 11 times less likely to be in the hospital if they'd had those 2 shots. And of the kids who were severely ill from MIS-C, all of them were unvaccinated. So vaccine is 100% protective against severe MIS-C. So get your kid vaccinated if you haven't done so already. And the other thing is we need to slow down the spread just so we can keep our schools open. We're having problems. We just have enough sick teachers, bus drivers, etc. It's really making it hard for our schools to stay open. We want to keep the kids in the school because that's where they do best, and parents need them there so they can work. So do your best to slow down the spread so we can keep our schools open and not have to start closing them here this next week or two. Still the narrative out there, people keep claiming that, oh, it's not that much worse than influenza. I think this is a great visual. Essentially, these lines here, this is, typically during the winter, pneumonia-like illnesses, and the pneumonia can be anything can be caused from anything from influenza to pneumococcus to metapneumovirus to RSV. There's lots of things that cause pneumonia. And so you typically see these surges. This wavy line is the typical. This is a bad flu year from a few years ago. This is COVID since it's happened. You'll see there's almost no comparison. And if you want to actually look at diagnosed deaths where a doctor has said, what did this person die of? These are the typical numbers for an influenza year. Not typical, these were the numbers of prior, where the doctor said this patient died of influenza. Those are those small yellow blips. The blue, these are doctors saying this person died of coronavirus. And so you can see there's almost no comparison as far as how much bigger this is than influenza. And it's not just for adults. Yes, kids are at less risk than adults. However, coronavirus is also worse than influenza in kids as well. So these are the cumulative deaths of children from coronavirus compared to the last 10 double seasons of influenza. So you had an influenza season, typically it goes dormant for 6 to 8 months, then comes back again. If we stack 2 of those in a row for the last 10 years, every single time, COVID is about 3 to 4 times as bad as an average year. So it is worse. Another way to look at it is just deaths overall. And so this is all deaths, not just pneumonia or influenza or coronavirus. Here's the effect, a few years ago of that bad flu year. So yes, there's an effect, and it's easy to see in this. Not that, although it's not that bad. Here's their last 2 years of excess deaths due to coronavirus. And so this is just not even a comparison hardly. And what frustrates me is that, we have learned a lot how to make this not as bad. I think a poster child for not getting it right would be the state of Arizona, which is this green line. They actually did keep things pretty tamped down for a while, then had that huge winter surge, went from the, not to, I guess, middle of the pack to the way worse in the pack. Now they might even pass Mississippi. New York and New Jersey, they got hit right away before they knew what they were doing, so they were the worst for a long time, but everybody's passing them now because they just didn't learn the lessons of the past. Nebraska, been mostly doing okay. I think primarily because of some good public health initiatives in Omaha and Lincoln and a few other communities, mainly the schools. We've done a better job of getting some people vaccinated, monoclonals, things like that. We could have been this good, but unfortunately we just didn't have an organized state effort. But at least we're not up in this area, and hopefully we can keep it that way. Right now, basically, we're getting to the point. This is a pandemic of both the unvaccinated and the immunocompromised. The difference between these people is these people, the unvaccinated, chose to be that way, whereas the immunocompromised had no choice. It's not their fault. It's the fault of these people that they're not protected. And so how do you protect folks, your family members, your loved ones who are immunocompromised? Well, you vaccinate as many people around them as possible to protect them. And then step up to better masks. So I personally, the KF94 fits my face better, so I go with that. KN95, N95, the cloth mask from a year ago that's falling off your nose, that's just really not adequate anymore. So step up to a better mask given your situation. Maybe if you're just running into a quick stop, that disposable surgical mask is okay. But use something this when you're around in public settings around other people who are not vaccinated. Hopefully this is helpful to you. Hopefully by next week we aren't overwhelmed, but I guess we'll just have to wait and see.